Then one important step that we have to remember, after when subject is telling that vibrations are disappear, vibration बंद झाल्यानंतर बोट खाली करायचं. Then we have to test it for our own mastered process, that really vibrations are disappear or not. Okay, so this is the test of vibrations. Then stereognosis. Stereognosis means it is the ability of person to identify the object with the closed eyes when we hold it in the hand. That is called as stereognosis. तर या प्रोसेसमध्ये आपल्याला काय करायचं, या स्टेपमध्ये आपल्याला काय करायचं, तुम्हाला डोळे बंद करायचे, हातामध्ये मी एक वस्तू देईल, ती तुम्ही ओळखायची ही वस्तू कुठली आहे. ओके, हां, डोळे बंद करा. आता तुम्ही समोर बघा, हे ओळखा काय 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 सांगा ना. नाही, डोळे उघडायचे नाही, काय ओळखायचं. खडू खडू. हां, ओके. हां, आता सांगा. पैसे पैसे. ओके, व्हेरी गुड. त्या हातात घ्या. काय ओळखा. कर्कट. नाही, नीट बघा, नीट बघा सगळं. चावी. हां, चावी. ओके, आता आता काय सांगा मला. पेन. पेन. Good, very good. So this is the stereognosis, means identifying the object with closed eyes, as it is the known subject we have already seen previously. Then the sense of temperature. In the sense of temperature, we have to fill the test tubes, one with warm water and one with the cold water. So this is the test tube having with the warm water. Warm water is having the temperature 10 degrees Celsius more than the room temperature, and this is the test tube which is having with cold water, which is having with temperature 10 degrees Celsius less than the room temperature. And when we ask the subject to hold the test tube, or when we touch it to the skin, then subject will tell us whether it is warm or cold. Okay, आता याच्यामध्ये ही थोडी गरम आहे, गरम पाण्याची म्हणून, आणि ही थंड पाण्याची फॉर एक्झाम्पल. तर ही लक्षात ठेवायची, गरम पाण्याची, थंड पाण्याची. तर जी टेस्ट ट्यूब मी तुम्हाला लावल्यानंतर ती थंड आहे की गरम आहे हे तुम्ही सांगायचं. ओके, डोळे बंद करा आता. गरम पाणी. गरम. ओके. गार. गार. ओके. गरम. गार. Okay, very good. So by this way we have to use the two test tube filled with water, warm water and cold water. The sense of temperature is detected, as it is the superficial and the cutaneous sensation. It is actually carried out by lateral spinothalamic tract. Now in different sensations which we have tested here, up to the proprioceptive sensation or the temperature sensation, pain and thermal sensation is transferred by the anterolateral system. Crude touch sensation is transferred by the anterior spinothalamic tract. Pain and the temperature sense is carried by lateral spinothalamic tract. Then the fine touch, tactile localization, tactile discrimination and stereognosis, as well as proprioceptive sensations, all these are transferred by the dorsal column medial lemniscal system. Okay, so this is about the different testing. Now about the tropic changes. Tropic changes are that if nerve supply to any portion is damaged, that is leading to loss of nutrition from that particular part, and because of that, even though there is stimulation, but sense is not appreciated from that particular region. Ulceration is there, bluishness will be taking place because of loss of nutrition, because of loss of innervation to that particular part, or the sensory loss from that area, leading to no reflexes from that particular portion and no sensation from that particular portion, and because of that, that is leading to certain changes. What changes that are there? Skin become bluish, shiny, cold, thin, ultimately leading to ulcers. Then muscle atrophy of that particular place is there because of loss of sensation. Then withdrawal reflex do not take place to the pain also. Bones become brittle and is susceptible to the spontaneous fracture. And joints hypermobile due to decreased intercellular tissue and laxity of the ligaments. So these all are the trophic changes taking place if there is no sense or damaged sensory aspects of that particular region. Then examination of the spine. In the examination of spine, we have to test it for by the two ways. By pressing slightly forcefully from the head region, we have to ask the subject to any pain is there in the spinal region or not, or the vertebral region or not, that we have to test. तुम्ही इकडे ह्या बाजूला फोन करून बसा म्हणजे तुम्हाला आणि शर्ट आणि बनियन का शर्ट काढून this is about the examination of spine. For the examination of spine, we have to focus toward the vertebral part of the subject, whether any pain is there by pressing from the head region, or we have to test it by pressing to the aside of each and every spine. बनियन नाही काढायचं नाही, बनियन चालेल किंवा काढायचं चालेल, काही प्रॉब्लेम बनियन